is an associate member of NACN USA who wears two professional hats. She is a board-certified healthcare chaplain, providing support to individuals from diverse spiritual and religious backgrounds, including those in hospice and palliative care. In addition, Mary is a registered dietitian in private practice, specializing in integrative and functional nutrition, with extensive experiences as a diabetes educator and in treating eating disorders. She's the author of a recently published book, The Renewed Practitioner, How Spiritual Care Transforms Nutrition, Dietetics, and Lifestyle Medicine. Having presented across the United States and Canada, please welcome Mary.
So I know I have quite a task. We're right after dinner, and we've heard a lot of things. I think it is really so cool the way the Lord has us each have a unique and distinctive message. So we've heard a lot of beautiful things about bringing forth, connecting to the sacraments in our devotional life as Catholics. And I'm also a devotional Catholic. My husband is Deacon John. So I'm going to ask that we ask the Holy Spirit to just rain down upon us right now, and that I'll be guided in what I say, and you'll be guided in what He has for you. So I think our Catholic lens means universal, and we want to know how to reach people that might be in all different places in the continuum. So here's my book. I also have some trainings, some inexpensive trainings. But this is the most common question I get from practitioners, from health practitioners. How do I share my faith? So we're going to broaden our lens so that we know how to wrangle and work with everybody. And it's just like with our faith. When we start off with our faith conversion, we tend to follow the rules. We develop to having a more complex faith. So that we're going to expand the lens. And I want you to look at the Catholic anthropology of the human person. I did my master's in nutrition when I was a young one, and I stayed home with kids, and I was all disillusioned with practicing in the modern healthcare. I was tired of treating symptoms, and I wanted to treat the whole person. So I did a master's in Catholic theology, an MA in theology at Loras College, a certificate, postgrad certificate in Ignatian spiritual direction, and then the 1,600 hours to be a board-certified healthcare chaplain. But in the midst of doing my theology, I studied theology of the body, did my thesis on it, and studied with Christopher West. So if we look at it, we have a beautiful lens, and what we do is bring it all together for any person, the Catholic person, and any human person we treat. So what we say is we have a metaphysical aspect of being human, and it's manifest out through our physical body. So we're human persons with an integrated soul. And if we look at Catholic Catechism, we have a spiritual soul, every one of us, but a lot of times they're kind of covered over and undeveloped. And when we work in healthcare, if you're in the hospital, you have access to a healthcare chaplain, more or less, probably. But if you're out in the clinic, there are none to be had, and if you don't know how to address the spiritual need, those spiritual needs are going to be unaddressed. So we have a rich lens, and we want to be able to apply it. So I love this work. This is Dr. Conrad Bars, and he is a contemporary of Viktor Frankl. He was a concentration camp survivor from Buchenwald, psychiatrist, and he noticed when he got out of his training, he was providing traditional psychiatric care and people were not being healed. So he got the writings of St. Thomas Aquinas, the human anthropology that were a mix of emotions and thoughts and willing. And he realized that what's really wounded in our persons, the Catholic thought is at our deepest core, we are good. It's not, more of the Protestant lens is that we're kind of whitewashed dung. And that's not Catholic theology, that at the core, we are good. But what's wounded is that integration of our feelings, our thoughts, our ability to choose and will. We just don't do what we want to do, what we know we should do. And so that's what we offer in spiritual care. So I'm going to talk about the skills you want to develop to offer effective spiritual care. And when you're thinking about forming students, this is something to think about. They develop incrementally, just like you do. So when we look at it, once he integrated the writings of St. Thomas Aquinas in his psychiatric practice, he showed tremendous healing for the neuroses, for the OCD people, the people with repressed feelings. In our intellectual enlightenment, we tend to stuff feelings away and work with what we know in our minds, and so we become unbalanced. And when we get into spiritual care practices, we help bring that integration back together. So there's been a lot of study. Now, I'd say nursing has been looking at spirituality and health for probably 45 years. When I was researching this book this last year, I looked at literature like 45 years old and on forward. A neat study here is this one by Longs and Simmons et al. From 2024. And it was a scoping review. They looked at 15,000 empirical papers for 22 years to look at the impact of including spirituality in the care. And they noticed some overwhelmingly strong ties. They're calling it a strong social determinant of health, spirituality, and that we want to provide training. So having our own devotional life is a good starting place, but we want to know how to apply those skills to a wide range of people. And we want to impact our health systems so that they take into account spirituality. Our Catholic health systems in addition. Now, when I looked at the literature over the last 40 years, these are the main spiritual benefits. It's amazing. So when people have positive spiritual practices, it changes our telomere lengths on our DNA. It turns off DNA methylation for systemic inflammation. It improves our glucose regulation. I have references at the end so you can see where I got all of this. And incidentally, too, it activates the frontal cortex. They did a really interesting study putting people under the MRI while they were praying, and then they played a health message while they were in there. And the people that had positive practices had the activation of the frontal cortex, so they were more alert. So I'm hoping that I'm activating your frontal cortex right now. And then they also showed a decrease in stimulation in the parietal lobe, where all the conflict, oh yes, but all the resistance comes. So it downplayed the resistance and it increased our alertness. So it is amazing. If we don't take into account a well-rounded spiritual care, we are leaving a lot of things in their body unaddressed. And just like the Sister Claire's, the nuns that were doing spiritual care, they noticed people preferred the nuns coming in because they carried a presence with their person that was healing. So we might not use religious language right off. We'll be guiding it, and I'll show you how this is. Spirituality is a dynamic part of being a human person. That's what our Catholic lens shows us. It's part of how the human is made. It's part of natural law. And that we seek ultimate meaning and purpose and a relationship beyond ourselves. So hopefully, people become awakened to those needs in their hearts, and they find other people that are cultivating similar practices and beliefs, like our Catholic community. They join other people and they find religion. So God is active in both spheres. So probably the biggest struggle that I have, we'll see in a little minute, if you're not spiritual at all, you avoid spiritual topics generally. And if you're strongly religious and you haven't had your lens expanded, you only treat people like yourselves with a religious lens. And so we want to reach everybody. So it's like life itself is disintegrating. You get a difficult diagnosis. You feel lonely and nobody's visiting you. Life can be disengaging. We all have grief. So it's like we're living like Ezekiel 37, dry bones. And when we become equipped, we want to be able to help those dry bones take on flesh. We often misunderstand what spiritual care is. So we want to think about a direction where we're less in charge and control of the interaction, and we can collaborate better with patients. So I'll show you how that is. In this day and age, there's a lot of wacky things that spirituality can, come up, the facade of spirituality. I was at a training with health professionals, and this woman, she said, I'm Catholic, but I was sitting in the doctor's office, and this guy's, shimmied over to me, and he said, I'm a medium. I talk to the spirits, and she said he was really interesting, but everything about him just kind of gave me the heebie-jeebies. Yeah. And I said, well, that was really good discernment. What we want to avoid is that we are not the origin. Like, let's say Reiki, healing touch, and yoga. Those are all the wrong direction of spiritual care. Yoga is a spiritual practice with some minor physical benefits. We do not need to chant to ancient Hindu gods to get benefit. We can just do Pilates. And healing touch and Reiki, the practitioner is the one that's balancing the forces, and that's the wrong direction. We want Jesus to touch his people, and we're not the origin of it. So this is how we broaden our lens. So like at the very top, you'll see, if you're not very spiritual or you haven't thought about it, maybe like some of your students, you have these unnamed needs. You might avoid spiritual topics because you're afraid that you'll be stepping out of your scope of practice, or you'll offend somebody, or you don't know quite how to recognize it. I have a neat little freebie out there on how to recognize a spiritual need, because sometimes it doesn't sound religious. And so then you progress, you provide spiritual care to the Catholics that you're caring for because you're comfortable. You can call the priest, you can say Hail Mary, and that's not wrong, but that's a place to start. And then maybe like the next one is using yoga or something you read in the evidence. What you want to develop, this is kind of the progress. You learn how to listen to the cues from the patients that are sharing spiritually oriented needs. Like they don't have a meaning and purpose, or they wonder why they're here, or they're not sure how to renew themselves, they're burnt out. Those are all spiritual themes. And you want to learn how to recognize them and to welcome them. And then you move on to assessing meaning, purpose, distress, and grief, ways they renew themselves. Because if you notice, if you can help them tap into their spiritual needs, they have better flourishing health, more motivation, and spiritual growth. St. Irenaeus said, the glory of God is the human person fully alive. And spiritual care allows us to be fully alive and close to God. They go together, and you have less inflammation. So this is a wordy slide. I hate to put lots of words on slides, but really there's 3 rows. You see, the top row is you learn about spirituality. You learn about what it is. Maybe you take a class, or you go to a lecture like this and you realize, oh, there's wider things to consider than just whether they're Catholic or not. So you grow an understanding and knowledge of what a spiritual need might be. We all need to grow in the breadth of our lens. What gives us meaning, purpose? Why do we wake up? A lot of us are burning out because we've lost track of the animation of our lives. Spirituality is the animation of our lives. It integrates everything together. So then you take your growth and understanding, and you want to continue to be reflective and have some spiritual practices, like the Divine Mercy. Wonderful thing. Adoration before the Blessed Sacrament. You reflect on what you know about your meaning and purpose, your vocation, and so you grow in some positive attitudes. What's missing for most health practitioners is the 3rd row. We get focused on whether we use a spiritual assessment tool like the FACTS or the HOPE or the Joint Commission thing. That is just the beginning in being able to tackle a spiritual need. You want the 3rd part, the growth in attitudes, you need to pay attention to how you engage with people. So you want to reflect with your clinical encounter. And you notice, like one dietitian was telling me, she said, I've been working in the dialysis center for like 4 or 5 years. But I noticed, now she was pretty astute, I noticed that when people are starting going downhill, I avoid visiting with them. Because I said, oh, well, wonder what that is. Want to be curious. Wonder what that is. She goes, well, I know. I don't want to deal with the grief that comes when I get close to losing them. So at least she knew that she was doing it. A lot of times when you reflect on your clinical encounters, like with friends, or one of my low-cost trainings is we do an 8-week session where we reflect on, each person reflects on a clinical encounter and we pay attention to where you went. When they started on an emotional topic, did you pop up and give them information? Wonder why you did that. So to really offer spiritual care, we want to really develop our capacity to engage them, our availability. And that will help us really grow. We become able to learn from our patients. And what we want to do is move from high RN control to high patient collaboration. So you can see right there, we mature over time in being able to offer spiritual care.
You said it develop our capacity to
being available. So when you have a spiritual conversation, it is not diagnostic listening. You're not listening. You want to listen to see if their feelings they're sharing, are they depressed, and am I worried about suicidality and stuff like that. But mostly you want to be able to let up control and be available to whatever they want to tell you. And when you're open and you're available, they will tell you a lot of things. And what we notice is if they don't bring that little thorn out of their heart, it festers in inflammation and poor glucose management, poor cognitive health, neurodegeneration, all that. Does that make sense?
Undergrowth and understanding in the middle part, you said something about spirituality. It's a beautiful phrase.
Yeah. Let me think. So the basics is that we grow in understanding, attitudes, and competency.
Oh, golly.
Oh, Saint and Irenaeus is a human person fully alive. And spirituality integrates everything and pulls it into a working whole. Yeah. So you can tell that there is stages of growth. It's interesting, most competencies, when you feel comfortable and you feel confident in executing that activity, you have a high level of proficiency, wouldn't you say? Isn't that how most competencies are measured? Spiritual care does not fit that at all. Because they did some really interesting studies. Masio of 2024 did some really interesting studies. They took nursing competency in spiritual care. In the EPIC in Europe, they developed 4 areas of competency for nurses: intrapersonal, interpersonal, spiritual assessment, and spiritual care provision, those 4. And when they developed a self-assessment tool, oh, it's so nice. You guys do such good research, okay? Then they gave it to nurses, and they found everybody overestimated their proficiency because they were really comfortable and confident in giving spiritual care. Well, what end of the continuum is that on? RN control or patient-led control?
RN control.
You bet. That's how we develop. First, you want to know the skills are there to develop, and then you learn how to apply them broadly in your own life and to those that you serve. And you learn how to listen and let up control. So the spiritual conversation is availability listening. It's not diagnostic, where you're having to develop, listen for signs and symptoms and all that stuff. Well, let's see. So you start off, the RN performs, and she kind of decides, and he or she decides the spiritual care process. Then she learns how to elicit responses from the patient about their needs and desires. Third, they learn how to accompany them. in the thoughts and the feelings. And then stage 4, they have to learn how to collaborate with that patient. Sometimes you got to confront the patient. It's not all touchy-feely availability. You go, I wonder if you can go back to that spot. You keep mentioning your dog. Sure, there's nothing, are you grieving? So you have to, in the stage 4, you become comfortable in learning how to gently confront or bring them back. So do you see how the skills develop in complexity with spiritual care? From the RN in control to the person being able to collaborate with that person. So spiritual care is not therapy. I've had a lot of practitioners say, I haven't had any training, I'm not a therapist. If you are a therapist, you have a harder time doing spiritual care because you get your roles mixed up. It's companioning care. In spiritual care, you want to be like an alert friend, and you know how to help listen to things that they've lost, what they're worried about, what they're going for, what's their motivation. And let me give you some stories. So one time I worked as a dietitian and a healthcare chaplain in the 30-day addiction center, okay? And one woman came in, she was a young fentanyl user, and she didn't say a lick about anything religious. She was telling me her story. And when I was listening to her, I kept getting the words, the Lord is my shepherd, there is nothing I shall want. You know, the Psalm 23 just kept running in my mind. I thought, got it, Lord, you want me to mention it. So I throw it out there. I say, now I don't know what this means to, but I keep getting the words, the Lord is my shepherd, there is nothing I shall want. She went, oh, when I was staying with Grandma, she would always read that psalm to me. She's with me. Oh my God, God is with me. So the Holy Spirit's really active. Another guy, he was an alcoholic, and not like another again. He was nobody he had no faith formation at all. And I said, well, where do you feel the most alive? That's a good question. You can write it down. Where do you feel most alive? He goes, I feel alive on the ski slopes. He started skiing. We live in Colorado. He started skiing at 2.5. Now the guy's like 40 or something, midlife. And he said, I feel so good skiing in powder. And I said, well, being from Iowa, can you tell me, is it good to ski in powder? He goes, yeah, Mary, it's real good to ski in powder. So I said, okay, well, just dwell there, okay? Whenever you want comfort, just go back to that memory of skiing in powder and just feel that aliveness. So he goes, okay. So I saw him, every 4 or 5 days for an hour. And he goes, yeah, I just feel so good. When I think about that, I feel like there's a force in the universe that's loving me. Oh, I said, well, dwell with that now. So that's the spiritual question. And then by the end of 3 weeks, we started to ask God questions. So when you don't have to use religious language, Holy Spirit is really alive and active when we're guided. So you can take them to their flow place where you feel loved, who's your community. And the Holy Spirit loves that because it's holiness right in the moment of their life, and he loves to meet them there. So really, we are not the fixers. Healthcare providers are fixers. We like to get it right. We want to help them and get the thing going. So we want to develop our own spirituality and our practices, but then we let God guide them. So it leads us, somehow this slide is unformatted, but we want to be learning from our patients to develop spiritual humility so that we can be surprised by their life story. Okay? So we are people that help others integrate their faith, their thoughts, their hopes, their desires to have flourishing health. Here are 2 questions to get started, okay? Incidentally, it's not just Joint Commission that requires spiritual care. It's the National Consensus of Quality Palliative Care also does. They require all practitioners to address spiritual pain and spiritual needs. 2 questions. The first one is, this is right from, we call it dignity therapy. What do I need to know about you as a person to provide you with the best care? Don't underestimate the quality or the power of that one question. They'll start telling you what matters to them, who's with them, what are they questioning, or what are they missing. Question 2, there's a whole way to assess spiritual needs using a mattering scale. So what matters most to you when you consider your life? So just by us giving them that 5 minutes of eye contact and undivided attention can show them that they matter to us. And that's tremendously healing, and God can really, really use it. So we want to develop our lens, our interior faculties, and our awareness of people's needs so that our lens broadened. I have 3 spiritual trainings just to get people started. 6 CEUs with spiritual care practice and tools. It's 2.5-hour live sessions where we look at spiritual care tools. My book has many spiritual assessment tools. One that I particularly like is from the Niagara Health in Canada. But just some really good assessment tools, places to get started. The second one is grief and spiritual distress in medicine, personal and clinical strategies. They're 5.75 CEUs for $65. And then the clinical formation experience from knowledge to mastery. That is only for 8 people, and it runs for 8 weeks. And everybody presents a clinical encounter, usually one that has a niggle for them. You know, those patients that just there was something that you didn't feel good about. And that's a prime one to take and write up as a clinical encounter and present it. And then yourself and peers will kind of learn how to navigate and look, what were you doing there? 18.75 CEUs for $250. My book. Any questions? Yep.
Do I have to go walk up there?
If you could talk loud enough.
Okay, sure. So it's less of a question, but I love how you brought up yoga. So as a former avid yogi, I wanted to put out a plug for people who don't know about Catholic alternative. I don't know if anyone has ever heard of Soulcore. Yeah. So Soulcore, for people who don't know what that is, it's this group of gals down in Indiana who basically pair Catholic prayers with exercise. So they focus on the rosary, but we also do the Divine Mercy Chaplet. They do sorrows, all these other things, and that's $15 a month I spend on it. So if people are interested in doing that, it's a good alternative.
Excellent.
Yeah. So I get 2 birds with one stone. I get to pray and I get to work out.
Yeah, you have a community of belief around you.
Yeah.
Is it soul core or cave?
I spell that.
Oh, I spell that one.
Your body.
Soul and soul.
Oh.
Yeah. That's what you are.
And usually when you do it too, like part of that money goes towards whatever cause that instructor is supporting. So usually there's some kind of a.
Okay, did you have a question?
This is wonderful, and I'm gonna look at it again because it's page. So anyway, the question I have, so the 2 therapies that seem to be pushed in primary care, like when you refer them to mental health and then you work together, is centering and oh my gosh, I'm sorry. What?
Mindfulness.
Well, thank you, and mindfulness. Is your mind full or are you
Humans don't empty, and that's not the point. We want to, just be more and more aware of God. I like to dance with God, all right? I walk into a patient's encounter, I glance at him and say, "You with me?" I go back in and do what I gotta do. Then I finish, I glance at God, hope that went well, guide him, and I go back and do what I'd like to do. I'm just trying to integrate God in the midst of the day. Quieting, centering prayer, if you like, it's a place to get started. It's kind of artificial for me to keep chanting a mantra, but, pay attention to what you need.
I'm just saying it's not very.
Yeah, I would steer away from it unless we have a Catholic lens in our prayer, right? In renewing our own selves as practitioners.
I don't know, I kind of disagree with you because Teresa of Avila definitely was contemplative and did, what I think you could you could see centering prayer. And I would also just say, Mother Angelica used to say, don't tell me you don't know how to be contemplative. Think about that person that just drove in front of you. You've been thinking about them all day and night. Yeah, your roommate on, you know, people that make you mad, whatever, you can't get it out of your head, because that's what contemplation is. So keep Jesus in your mind and contemplate him when you do all the people that are driving you nuts.
And then just broaden your lens as you're working with patients. You're not watering the faith down, you're being Catholic, more universal. The spiritual needs come through a lot of aspects of human life.
And pray the St. Michael prayer, keep the enemy out of that.
That comment was pray the Saint Michael prayer to keep the enemy out.
Right.
I wanted to say something about St. Teresa of Avila. When I was reading her Castle, the 3 books.
Yeah.
Interior Castle. Yeah. The Interior Castle. She did say, though, that some of her nuns wanted to get with union with God immediately. And so they would go into prayer to try and get a union. And she said that she knew no other way than to focus on Christ. And if union happened, fine. If it didn't happen, fine. But her focus was on Christ. And sometimes I have problems with, what's it called, the contemplative something outreach, where they want you to clear your mind and just have everything.
And then you feel like a
blank.
failure if you.
Right.
Yeah.
Well, humans, that's not our point to be empty. Our point is to be centered in God, right?
Right.
So my book has 2 parts. The first part is how to continue broadening your lens as a Catholic, how transcendence, my book, so how to work with your ethics, because we want to develop holiness as we apply these skills so that we're ethical. And the second half is taken from clinical pastoral education training chaplains, how to reflect with your clinical encounter and grow from it. So, yeah. And I do have a little awakening sheet, because a lot of us are burning out. If we don't have practices that renew ourselves and center ourselves in the why of our field, we tend to wear out. And so this is just a mattering exercise for practitioners.
Yay.
Thank you very much.